the other without ambiguity. That's what you want to achieve. That will be your goal. So if I want to control, so you mentioned appetite and satiety. Okay. So a patient is hungry. What is the first thing that will happen in that axis? What will be released first if someone is hungry? Ghrelin. Okay. So ghrelin will be released first, as well as what neuropeptide, right? Both of them they do the same thing. So both going to be released. Where are they released from? That's the first one. Where's the source of ghrelin? Okay, from the stomach. I don't know. I don't know which cells make it. Hopefully they won't ask you that, but you might check it up. Yeah, just to know that. But okay, so from the stomach. So and when ghrelin is where will ghrelin go? Where will it work? Where in the hypothalamus? The lateral hypothalamus. Okay, and it's going to stimulate. So that is where receptors are in the lateral hypothalamus, right? It's going to stimulate the lateral hypothalamus and stimulate, right, appetite. Good. So I will eat. Okay. Now I'm eating. Have a bag of rice, and my stomach is full. So what happens next? Now, how do I shut down appetite and trigger satiety? Okay. By leptin is not released from by the stomach. Right. So so the stomach stretches out the blood, sends signals to the hypothalamus probably directly or that's possible. But remember also as I'm eating all those carbs, right? Glucose etc. I'm going to be converting them to what? To to fatty acids and cholesterol. So the adipocytes are filling up, like you're filling a tank, right, with petrol. The adipocytes are filling up with fuel, energy, fatty acid, triglycerides. As the more they increase in mass, the more leptin, right, they release. But you don't forget endocrine. That's why you see now, when we say endocrine system, we're always thinking of some organs, blah, blah, but that adipose tissue, they're also endocrine glands. They make hormones, which is leptin in this case. So, adipocytes make leptin, and then where would leptin go? So leptin goes to the ventromedial nucleus and is going to, so that's where leptin receptors are in the ventromedial nucleus. Good. So we're going to stimulate the ventromedial nucleus and that would trigger, right? Satiety. Patient stops eating. Okay. All right. Any question on that? All right. So follow-up question. Oh, God, you're not doing pathology. I wanted, nah, it doesn't matter. Tell me, all right, so what can go wrong with that axis? What can go wrong? What do you think? Mhm, yeah, okay. So if there is problem with yeah, the appetite center, right? Okay. So right, either problem with the production of ghrelin, neuropeptide, something wrong with their receptor, or something is wrong. There's damage to the what hypothalamus, right? The lateral hypothalamus. Then patient will be eating. So that can lead to eating disorders, anorexia, weight loss, things like that. Okay. What about, and if is a pathology that is stimulating the pathway in excess too, right? That can also happen. Receptors are hypersensitive. If the lateral nucleus is right, hyperstimulated for some reason, that will lead to increase, right? Food intake, and that can cause obesity, weight gain, things like that. On the satiety side, decrease in that pathway or hypofunctioning of that pathway will lead to weight gain too, right? The patient will be eating in excess without feeling full. And a lesion in that pathway, on the other hand, will lead to weight loss. Hyperstimulation, yeah, they feel full all the time, rather. So, weight loss. All right. So that's like on a basic level, right? What overall, right? What can happen? They can give you experimental questions where, right? They're talking about maybe making medications, and they can be asking you, right? How well would the medication work? If I want to make a medication to trigger weight loss, where will it work? Maybe in the hypothalamus. But they can say the medication is mimicking what endogenous, right, hormone in the body, right? Whether leptin or ghrelin, things like that, depending on what the medication does. One of the pathophyes, what is the pathophyes of DM2? What's the pathophyes? Diabetes mellitus type 2. They are desensitized. The receptors are desensitized, right? It's not sensitive to insulin. So the question is why? What leads to insulin receptor desensitization or resistance? Why is the receptor resistance to insulin? Why? So it's not a coincidence that what DM2 patients are typically what obese. They are overweight. They have higher than normal BMI. It's not a coincidence. It has a role, it plays a role, right, in the pathogenesis of the disease. It's not a coincidence that central adiposity, right, is related to what? Glucose intolerance. Yeah. Because remember we said adipocytes are endocrine glands. One of the things adipocytes make is what we call them, they also make like lipokines. And lipokines, an example of a lipokine they make would be TNF alpha. And those lipokines can degrade or downregulate, right? Or increase the resistance of insulin receptors. So which means the more adipose tissue mass a patient has, the more adipokines or lipokines they are making, the less sensitive insulin receptor gets. Because those receptors, those adipokines, they kind of inhibit the function of the receptor. Yeah, and that can now lead to what? Glucose intolerance. If it continues, right, eventually leads to what? Type 2 DM. So one of the genetic bases of DM2, right, would be people that have maybe a mutation in their leptin, right, receptor, which means they don't feel full, right? They don't feel satisfied easily. So they're going to be eating more. They become overweight. Guess what? DM2 ensues. Make sense? Get it? All right. So, and also the interplay between the satiety and the right and the appetite center also explain, right, why obesity too. There's an epidemic of it, or the genetic basis for obesity. Yeah, why people can't help themselves because it's also a disease. It's not something right to take lightly. Yeah. So, all right. So that pathway is super important with that. All right. Thank you for that. What next?